You have until the 15th of April to comment on the proposed new COVID-19 regulations. They are expected to replace the National State of Disaster regulations, and those regulations include 50% venue capacity if those attending are vaccinated, 100 people at funerals, and regulations at airports. Wits University vaccinologist Professor Shabir Madhi joins us now to discuss these gazetted regulations, and I will be alluding to your writing in Daily Maverick in a moment, Professor Madhi, but I just want to get your overall impressions from some of the announcements that were made by President Ramaphosa this evening.
Good evening. Thank you for having me. Unfortunately, I think the speech was hugely disappointing. It didn't actually bring about much change other than people not needing to wear face masks outdoors, which is something that we should have gotten rid of more than 6 months ago. There's very little other substance to what was referred to. As you mentioned, much of it seems to be now dependent on the regulations which the National Department of Health have put forward for public comment. And those regulations essentially are illogical, irrational, and inconsistent internally as well. So unfortunately, certainly not what I would have wanted to hear from the president. I think there was an opportunity for us to make a break from the past, which has been a dismal failure up to now, and actually get along with the science, which basically tells us we're in a very different phase of this pandemic, and much of what we're doing hasn't actually protected against infections to start off with.
Yeah, and part of the argument from the side of the president, I recall at some point him alluding to taking lessons from other countries that opened up too quickly and basically just opened up everything and dropped all restrictions only to see a resurgence and in some instances having to reimpose some restrictions. So there's also the argument that says you can't have nothing. So if you're removing the National Disaster Management Act regulations, you've got to replace them with something because the pandemic is still out there, it's still there. And this something that we're replacing with is what you, in Daily Maverick, along with Mark Mendelson, Jeremy Nell, Professor Glenda Gray, Regina Osse, and Francois Fenter, you describe as incoherent and illogical.
Yes, I think we need to be careful how we interpret data and how we extrapolate from experience in other countries. Other countries that are experiencing a resurgence are in two different sort of camps. There's what's happening in China, what's happening in Hong Kong as an example, which is a country where there's been very little past course of infection with the virus, as well as where there's still gaps when it comes to the percentage of high-risk individuals that are adequately vaccinated. And consequently, when those sort of countries experience a resurgence, especially with the variants such as Omicron, they still remain susceptible to developing severe disease and dying from COVID-19. In the other camp are countries such as the United Kingdom, where a large percentage of their population have now developed immunity, largely from vaccines. And when they experience a resurgence, they don't see massive number of cases of hospitalization and death. The goal with COVID-19 is no longer about preventing infections. It's all about mitigating the consequences of infections and particularly reducing the burden of severe disease and death. Where we are in South Africa is that despite the really mediocre rollout of COVID-19 vaccines, with just about 1/3 of the overall population having received at least a single dose of the vaccine, at the same time, 80 to 85% of South Africans have now been infected with the virus at least once since the start of the pandemic. And that past infection brings about protection against severe disease and death. Now, the fact that 80 to 85% of the population have been infected with the virus at least once since the pandemic tells us that all of these regulations that have been imposed by government have failed dismally in preventing infections. And to somehow believe that they're going to still continue preventing infections despite it having failed in the past, I think that is somewhat naive because it's not going to happen. The main goal in South Africa is the prevention of severe disease and death. We're in a good space right now. It has come at a huge cost of life, 300,000 people having died of COVID-19, but eventually 80 to 85% of the population have developed protection against severe disease. The main goal is to actually improve on that. And the best way to improve that, the single most important thing South Africa needs to be doing is getting more than 90% of people above the age of 50 vaccinated, and then we will be in a space that COVID-19 is still going to cause people to die for the rest of our lifetimes. It's not a virus that is going to be eliminated, but the number of people that will end up dying or end up in hospital will be relatively muted compared with what we experienced in the past. So I think it's dangerous to extrapolate an experience from another country which is having a surge of severe disease and death from COVID-19, but where the population is susceptible to developing severe disease, unlike in South Africa, where the majority of the population is no longer susceptible to developing severe disease and dying of COVID-19.
So the proposed regulations in terms of the National Health Act are quite wide-ranging and cover a number of areas. But what are some of the highlights of some of the key proposals? Because there are proposals at the moment which is also slightly different from the way that the regulations have been made in terms of the Disaster Management Act, in that in this instance, there's a provision for public comment for at least 30 days between the 15th of March and the 15th of April. When you look at the whole basket of the proposals, which ones really are problematic, quite problematic for you, that led you to the conclusion that you make in the piece that you've written with other scientists on Daily Maverick?
Yeah, so I think we need to just take a step back. The Notifiable Medical Conditions, which is a document which National Department of Health has used, it's a document that was prepared a few years ago, in fact, when I was at the National Institute for Communicable Diseases. And it had a very specific purpose as to when you call a disease, when you consider a disease necessary to be notified, because it puts into place a string of actions that needs to be implemented. Now, that document was used, and it was somewhat sort of manipulated to try to accommodate for some of the regulations which are targeted more towards COVID-19. Now, you're asking me which of those regulations. We can go through the entire list. So let's just start off with, as an example, physical distancing of a meter, or the number of people that are allowed in an indoor space. It's not about the space between people or the number of people that are in an indoor space that will influence the risk of an individual becoming infected. It's actually about ventilation in the space. You can have 100 people in a closed space. If you've got good ventilation, very few of them are going to get infected. If you've got 10 people in a big space, but poor ventilation, all of them could get infected. So that is incoherent. And again, to emphasize, it's no longer about preventing infections. And government still seems to be stuck on this concept that it's wanting to prevent infections when we've actually failed in preventing infections up to now. When it comes to things such as outdoor gatherings, even a 50% limitation on venues, it's got absolutely no role, because on the one hand, we're now saying don't wear a face mask outdoors, which is a correct decision. But on the other hand, we're putting restrictions on the number of people that are allowed in an outdoor gathering, where there's a very, very low risk, in fact, a nominal risk of someone being infected in an outdoor space. When it comes to funerals, as an example, we're not allowing for more than 100 or 200 people, as an example, and no night vigils. But at the same time, we're allowing bars and pubs to operate at night without a curfew. People are more likely to get infected in a pub and a bar than at the funeral night vigil. So a number of inconsistencies. And again, it all stems from the disconnect that on the one hand, government seems to appreciate that there's an extensive percentage of the population that have developed protection against severe disease and death. But on the other hand, it still wants to hold on to outdated concepts of wanting to prevent infections. South Africa no longer needs to try to prevent infections. The infections have transpired. The regulations we've had in place up until now has not assisted us in reducing the number of infections, and we need to stop believing that we're going to achieve something which has failed in the past.
There's another aspect that that I'd like you to tease out, please, Professor Madhi, before we part ways this evening. That has to do with the original intent of these regulations. You remember when we used to talk about flattening the curve to allow the health system to be ready, because we used to worry about high rate of infection and a health system that is not ready, and then it becomes overwhelmed, leading to more deaths than could have been prevented. We're no longer talking about flattening the curve. And part of what you've written in your critique of these National Health Act regulations proposed as they are has to do with the fact that, even the considerations around the state of the health system in response to COVID-19 have changed?
Absolutely. And when the entire population was susceptible to developing severe disease and deaths, when there was very little protection against severe disease, then it might have played some role to sort of spread out the period of time over which the infections took place. It didn't reduce the number of infections. All that it did is spread it out over a longer period of time. And that did assist healthcare facilities, especially during the course of the first and the second wave, to deal with the demand on healthcare facilities when there was a surge of severe disease and hospitalization. But like I mentioned, we're in a very different phase of the pandemic now, where we've got extensive protection against severe disease. During the course of the Omicron wave, the wave that just passed now, none of the healthcare facilities came under any sort of pressure. And that's because we've seen this decoupling of infections and severe disease because of the evolution of protection against severe disease, largely, unfortunately, as a consequence of natural infection-induced immunity.
All right, Professor Shabir Madhi, I've got to thank you for your time and your insights here on eNCA. Do look out for that piece that they've written. It's a number of them as scientists weighing in on these proposed regulations. And that's really, that really should be our focus, folks, around these proposed regulations in terms of the National Health Act. They are meant to replace the national state of disaster. When it's lifted, government feels that we should have something in place. And that's something is those regulations that Professor Shabir Madhi and others have been commenting about. You have until the 15th of April to actually weigh in on those before they are finalized.